As a specialist physical therapist working with women as they're going through life's different transitions, I often get asked by new moms, when is it safe to run after pregnancy? And friends, I get it. I am an avid runner and mother of 2 children, one who was born in the United States and one who was born in Germany. And the advice I got after each pregnancy was quite different, which led to a large amount of confusion. In the US, at the 6-week checkup after giving birth, I was told that everything looked good and I was ready to get back to all activities, including intimacy. While in Germany, I had an internal ultrasound at day 4 after giving birth, and I was told that I could return to all regular activities, including intimacy. And friends, I am not going to lie. I told my doctor that if she told my husband that, we were not going to be friends anymore. But that's a story for another day. So as a running mom, I had a lot of confusion around this issue. Now you would think that as a physical therapist, I would know what to do about this, and I did know a lot of things. However, I did not realize what I did not know at the time. Specifically, I had no training in the pelvic floor or women's health in general, so I was going off of the general guidelines that were available at the time. Over the past 24 years, I have done way more study into women's health, as well as recovering from childbirth and the changes that come with our bodies over time, specifically perimenopause and menopause, and then while we're making that transition to retirement. Don't worry, I'm not retiring anytime soon. So today I am going to give you some really specific tips for you to understand if your body is ready to return to running after pregnancy. And generally, I'm going to share with you all the things that I wish I had known right after I gave birth. And stay tuned to the end because I will outline what your return to running progression should look like to help you have a successful return to running after pregnancy. All right, let's get started. First thing, we're going to talk about 6 things that I want you to consider while you're determining if you are ready to return to running. The first thing I want you to consider is, what was your physical activity before you were pregnant? So many people are asking me if they can get back to this exercise or that exercise. And the first question we need to determine is, where was your body before you got pregnant? So what is your base? What are you used to? Are you used to weight training or running or walking? Or were you not really exercising before pregnancy, but you're looking to bring exercise into your life to help you recover from pregnancy? This is really important to understand what your base level of fitness is, because that's going to determine your next best steps. Number 2 is a general rule of thumb. You were pregnant for 10 months if your pregnancy went to the ideal length, which means it's going to take 10 months for your body to recover. So I have to ask you, at what point during your pregnancy did you stop running? Now, you may giggle with that question because you may never have stopped running during pregnancy, and that's cool, but it's an important question to know because some people have to stop running for a variety of reasons. It could be medical complications, which is what happened to me with my second one. It could be just that you get so big, it feels really uncomfortable. It could be any number of reasons why you stop running. But that's an important thing to consider because that means you've been away from it for a while. And we all know that when you fall off the wagon, pregnant or not, it's much harder to get back on. And those first few runs are not going to feel as good. Number 3 is a general rule that can be a guideline, but I don't want you to think that it's a hard and fast rule. This rule is that in general, I recommend women have lost half of the weight that they gained during pregnancy. Now, to be fair, this is a general rule. I don't want you to think that it has to be exactly half, because everybody's a little bit different. But consider the fact of, have you lost a good portion of your weight that you gained during pregnancy? The reason why is because if you gained a lot of weight, which I did with both of my pregnancies, and then I'm trying to go running with a large amount of weight that I was not used to running with before, again, that's going to cause changes in my body, and it may not be the safest thing for my body. So I want to make sure that in general, you've lost about half of the weight that you gained during pregnancy to not have too much pressure or force going through your legs, your pelvic floor, your low back, your abdominals, all those different areas that will be affected when you start running. And that leads us to number 4, which is discussing your abdominals. You want to make sure before you return to running that your C-section scar has healed, that it is completely closed, and you want to make sure that you have no diastasis recti. So that's where your abdominals separate, which is very normal during pregnancy because you got to have room for the baby to grow. However, you want to make sure that those are back together. You can check very simply for diastasis recti. You can put your fingers right in the middle of your stomach, laying on your back, and then you can look up and look at your stomach as you lift up your shoulders and see if there's any kind of splitting that's happening right in the center there. It's usually pretty obvious and you can feel it underneath your fingers if you do have a diastasis recti, but I recommend if you do have one that you do not return to running, because that means you will not have the abdominal support that you need while you're running. Which leads to number 5, which is the pelvic floor. I do not recommend that you return to running if you have any bulging or any urinary leakage with laughing, coughing, jumping, sneezing, or running. And of course, that you have no pelvic floor pain at any specific time or with intimacy. All of these, the leakage, the pain, the bulging, all of these are signs that your pelvic floor is not functioning correctly, which means you should not go running and put increased stress on that pelvic floor. It is not going to be happy and it's going to lead to potential long-term issues. So is there any bulging? That's something that you would feel while you were taking a shower or your bath and washing yourself. Leakage, that's when you have any leakage with running, laughing, coughing, sneezing, anything like that. Pain, obviously, you know what pain is, but even with intimacy, that can be a sign of a pelvic floor dysfunction, and we don't want to propagate any of that with running. Now, ladies, one caveat here that many people, especially who are a little bit older, tend to believe that having some leakage with laughing, coughing, or sneezing is normal because you've had babies. Friends, it is not normal. You should be able to run without any leakage. So if you're having any kind of leakage with laughing, coughing, or sneezing, 1, please do not try running because that's only going to make the problem worse. But 2, please seek out the help of a pelvic floor physical therapist because they can help you solve this problem so it doesn't bother you in the future. And you may think, oh, it's not that big of a deal, but the research is really clear that if you don't deal with pelvic floor issues when you're younger, you may be dealing with total hip replacements when you're older. And I don't want to see that for you, friends. Okay, moving back to our new moms, number 6, I want to make sure that you check out your hips. In fact, I want to make sure, A, that your hips are moving equally on both sides, and 2, I want to make sure that your hips are pain-free. Now, as things are changing and your body is getting back to normal after pregnancy, you may have some twinges or some aching occasionally in the hips. That's not what I'm talking about. What I'm talking about is if you have regular hip pain. If you do, that may mean that your muscles are not going to activate properly when you get back to running. So you need to deal with that hip pain before you get back to running so it doesn't get worse. Okay, so you've determined that it is safe for you to return to running because you ran before you were pregnant, you ran at least part way during your pregnancy, you've lost half of your pregnancy weight, you do not have a diastasis recti, you do not have hip pain, and there's no bulging or leakage or pain in your pelvic floor. All right, what do you do next? I ask my patients to start with a very slow progression. I often say that my spirit animal is a sea turtle, and we just kind of move along slowly because I do believe that slow and steady wins the race. And I know, I get it, running mamas. I get it. You are going crazy and you just need a break and you need to get out there and get some endorphins. I totally understand. However, if we go too fast out of the gate, that can cause other problems to either occur or to become better known, and we don't want that to happen. So, slow and steady wins the race, all right? Step one that I recommend is starting with walking a quarter of your normal distance. So if your normal distance pre-pregnancy or even during the early phases of your pregnancy, let's say was 4 miles, because that makes it a nice easy number, you're going to walk 1 mile. You're going to maintain walking 1 mile. You can do it every day, but walking 1 mile for 1 full week, then you can progress to half of your distance. So if it's 4 miles is your normal distance, it'll be 2 miles. Then you're going to walk 2 miles. You can do it every day, but you're going to do that for an entire week. Then you can progress to 3/4, and then you can progress to your full normal distance, but we're still maintaining walking. I know this may seem very, very slow, but this is going to help your hips. This is going to help your pelvic floor. This is going to make sure your abdominals are on board so that you don't suffer with any injuries or issues with your return to running progression. And then we can move on to step number 2. So once you have reached your regular interval, so let's say again, 4 miles is your regular interval that you were running, and you have completed step number 1. So now you're walking 4 miles and you've done it for a week and everything feels fine. Now I want you to start implementing a walk-run interval. So we want to start with a 1-to-1 interval. So you're going to walk for a minute, run for a minute, walk for a minute, run for a minute for your normal distance. So again, in this example, our normal distance is 4 miles. So you can walk for a minute, run for a minute, walk for a minute, run for a minute. Now, I get it. That can be really hard to do, especially for 4 miles. And I don't love the run walk interval. Some people absolutely adore it. It is not for me. And I understand that this step may be very, very frustrating. However, it is going to help you make a successful return. Let's keep our eye on the prize, our eye on that goal, and be safe and healthy as we do our return to running progression. Once you've done the 1-to-1 interval for a week, you can do 1-to-2, which would be walking 1 minute, running 2 minutes. Then you can do 1-to-3, which would be walking for 1 minute, running for 3 minutes. And once you've done the 1-to-3 interval for an entire week at your normal distance, in this example, it's 4 miles, then the next week you are safe to return to a 4-mile run. And you can enjoy all the work that you've put in here to get there. So let's say you've gotten to your normal distance, which is in this case 4 miles. When can you start progressing your distance? Once you have successfully completed that 4 miles and you have done it successfully for an entire month now, we want to have a really good base before we start adding in mileage. We want to make sure that there is no issues with the bladder leakage. We want to make sure that there's no abnormal pain. Now, I get it. As you're returning to running, things get sore, things get stiff, they feel different. Our body is returning to normal, and we're still healing from that pregnancy. So I understand that there may be some twinges here and there. I'm not concerned about things that last less than 24 hours. However, I am very concerned about anything that lasts over 72 hours. Or any new symptoms that happen specifically in the pelvic floor. If you notice any new symptoms that last longer than 72 hours or any pelvic floor issues that occur while you're doing this return to running progression, I'm going to ask that you seek the help of a pelvic floor physical therapist to make sure that what you're doing is safe for your body. You see, everybody is different, and although I can give you some general guidelines, I can't give you specific guidelines that will work for your body. What I can tell you is that this is a very slow progression. However, it is what I wish I had done when I returned to running from pregnancy, because I didn't know then what I know now. And now I suffer with an SI joint dysfunction. I suffer with low back issues that were most likely caused by my return to running progression after specifically my first child. which may have also led to some of the complications I had when I was pregnant with my second child. But I didn't know all of these things then. And I wish I had known someone, I wish YouTube had been around at the time, so that I could have looked for ideas and advice at the time. And if you are struggling with incontinence issues on your healing journey from pregnancy, I'm going to encourage you to check out this video over here and download our free ebook, because we don't want you peeing when you're laughing, coughing, or sneezing.